This episode of GT the Podcast is supported by Alcon.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Richie Kahn, a health policy professional, clinical researcher, and patient advisor, recaps his article, Visiting the Glaucoma Clinic in the Time of COVID-19, from the January-February 2021 issue of Glaucoma Today. In this article, Mr. Kahn offers his perspective as a patient on the changes he has observed while navigating visits to the glaucoma clinic over the past year. Later, Dr. Andrew Iwach discusses a video resource for patients that demonstrates the measures providers are taking to safely deliver glaucoma care during the pandemic. Here's Mr. Kahn.
Having visited the glaucoma clinic multiple times in 2020, I've become somewhat of an expert in navigating pandemic-era appointments. Although my first visit of the year took place before COVID began running rampant across all corners of the Old North State, my subsequent visits have very much been in the thick of the public health crisis. I will admit I was not comfortable going to the clinic back in June, but in some ways, my hand was forced. I was testing a virtual reality-enabled visual field analyzer for home use and wanted to compare my results to the gold standard. Unfortunately, although the large academic health system my provider is a part of had invested millions of dollars in a state-of-the-art electronic health record system, the platform had not been designed to allow for the sharing of PDF files. If I wanted to review my VF test results, I had to venture into the practice and pick up the hard copies. I figured, why not go ahead with my regularly scheduled in-office appointment? After all, in for a penny, in for a pound, right? In a perfect world, I would have utilized an at-home IOP monitor and VF perimeter to get a handle on my optic atrophy, and my historic VF test results would have been sent to me via the patient portal. But because these options weren't available, I masked up, refilled my hand sanitizer, and headed to the clinic. While at the glaucoma clinic, I observed some key changes from the before times. Before I entered the clinic, staff performed an initial temperature check, and I was asked about any known exposures to COVID. After passing my preliminary screening, I was asked to sanitize my hands before check-in. When I reached the socially distanced front desk, I answered more screening questions and received a secondary temperature check. All clinic and office staff members wore masks, although none seemed amused by my party cat face covering. It was sort of hard to tell, though. No one was smiling with their eyes. Clinic staff had thoughtfully removed 75% of the chairs from all waiting areas. In my particular waiting area, I was the only patient present. Patient flow was drastically different to reduce potential exposure. Right after I sat down, I was whisked to an empty exam room. I sat in the exam room until it was time for my VF test, as opposed to sitting in a common area. Once the VF test was complete, I went directly to OCT imaging. From OCT imaging back to the exam room, from the exam room to checkout, and from checkout to the door. No common areas and no mingling experienced. Although the degree of personal protective equipment in use has varied from visit to visit over the past few months, all staff members have always been masked. Sometimes my clinician will wear a face shield for an additional layer of protection. Hand sanitizers everywhere, and staff members are constantly wiping down equipment. Whether considering clinical trial design or the structure of a clinical encounter, I am a big believer in removing patient burdens whenever possible, which includes fewer in-person visits that require patients, caregivers, and/or drivers to take time off work, and as many in-home assessments as practical. Before COVID-19, in-person visits were the standard. If there is one silver lining to the pandemic as it relates to glaucoma, it is that clinical care is becoming more patient-centric. This means putting the patient first and engaging more effectively in order to better experiences and outcomes. More in-home ocular assessments with targeted in-person follow-up as necessary would be a good place to start.
Since the start of the pandemic, many glaucoma patients have been grappling with the decision of whether to visit their eye care providers and potentially risk exposure to COVID-19 or to delay their appointments and be subjected to visual consequences that occur as a result. Dr. Andrew Iwach, Executive Director of the Glaucoma Center of San Francisco and Board Director of the Glaucoma Research Foundation, discusses one way to ease patients' anxieties during this challenging time. Here's Dr. Iwach.
Patients are facing some difficult decisions. Do they try to save their sight? Do they risk their lives? It's a real dilemma for some patients. Take, for example, a particularly challenging situation faced by one of my patients, a 56-year-old named Myra. In addition to being treated for glaucoma, Myra has been undergoing chemotherapy for stage 4 breast cancer. When the pandemic hit, she decided to skip her eye care appointments out of fear of contracting COVID-19. In May, Myra began noticing some new visual symptoms. By mid-July, she returned to me for evaluation. She knew something wasn't right, but she was afraid to come in. When she eventually came to see me, she had additional permanent loss of vision. Although I tried to reassure her that she did the best she could under extremely difficult circumstances, she now feels like she made the wrong decision concerning her glaucoma care. Most of Myra's fears about attending her appointments were alleviated once she visited the practice and saw the safety measures in place. She saw that you couldn't enter our center without completing a screening questionnaire, getting a temperature check, sanitizing your hands, and wearing a properly fitted mask. She saw that our practice was outfitted with plastic barriers and that all staff members were wearing protective gear. Once Myra could see these efforts herself, she realized she could continue feeling comfortable in our care. Because situations like Myra's are encountered by providers across the country, the Glaucoma Research Foundation has produced a video to show patients the type of safety measures that are now commonly in place across ophthalmic practices. The video, entitled "See You Soon," was supported by an unrestricted grant from Aerie Pharmaceuticals, and it features several glaucoma specialists from different regions of the United States. The ophthalmologists interviewed are not only from different parts of the country, but also different types of practice, and they have implemented changes in slightly different ways according to their clinical settings. But collectively, they emphasize that glaucoma care providers are concerned for patients' safety and are taking the necessary steps to minimize risk. Glaucoma care providers should consider spreading the word about the video, especially if they sense patients are reluctant to visit their offices due to COVID-19. Many practices have communication systems in place through which they can send messages to their patients. To me, the easiest way to share the video is to send the link to patients and say, here's some useful information to let you know how those in the glaucoma community, our practice included, are continuing to prioritize patient safety in the time of COVID-19. Although patients' personal eye care providers may not appear in the video, it may help patients to visualize some of the protections in place, emphasize the importance of their glaucoma appointments, and increase their comfort with resuming in-person care.
The See You Soon video is available online to view and download. Find it at bit.ly/GTSeeYouSoon. That's bit.ly/GTSeeYouSoon. Thank you for tuning in to GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care coming up on the next episode of GT the Podcast.